Hello, everyone. I am Leon Kircik. I'm a clinical professor of dermatology at Icahn School of Medicine at Mount Sinai in New York City. I also have my private practice and my clinical trial center in Louisville, Kentucky. I think TYK2 selectivity is important not only in hard to treat areas, but overall in treatment of psoriasis. As you know, in this case, it's not only the TYK2, but it's also the allosteric inhibition of Zasocitinib. Most of the JAKs, they have orthosteric inhibition of the ATP binding site, which is JHK1 site, versus in this case, Zasocitinib is binding is the other side of the domain. It binds to the pseudo domain, and it's the regulatory domain that is not directly competing with ATP binding, but it is allosteric binding, and it changes the morphology of the domain here, and that's how it works. So basically, allosteric binding makes very unique for this TYK2 for Zasocitinib, and also clinically it reflects on the adverse event profile in a positive manner. Also here we have 1 million-fold greater binding selectivity for TYK2 versus JAK1, JAK2, JAK3, and this makes it also very unique and important for the Zasocitinib, in addition to being an allosteric binding rather than orthosteric binding. As you know, in dermatology, we are very risk averse and we are very concerned about our safety profile of the drugs that we use. And here at week 16 versus week 24, week 16 is the placebo-controlled period, and we don't see any new signals in week 24 compared to that placebo-controlled period, which is very important. And the main thing that we see, which is expected from TYK2 inhibitors, is acne. And I always say in dermatology, we know how to deal with acne. We know how to treat with acne. We're not dealing with cancers, leukemias, lymphomas, or any other things that's out of our realm. Acne certainly is in our realm, and we know how to treat that. Other than that, we have seen nasopharyngitis, some diarrhea, headaches, nausea, which is all um, all the adverse events that we commonly see in most studies, since those are the most common things to happen during the studies, and of course they have to be reported. And then there was one important thing that we need to mention. There was one death in the Zasocitinib, but this patient, unfortunately, the death happened the day after the baseline after taking the medicine, and it was not considered to be related to the study drug. It was an unfortunate case that just happened on day one of the study. So I think we are very lucky to be in dermatology treating psoriasis at this day and age. We have more than 13 biologics to treat. We have some oral treatments coming into the pipeline. I remember when I was a resident more than 30 years ago, we used to use mixed tar, salicylic acid, and topical steroids to treat scalp. Probably if you do that now, it's considered malpractice. So we are very lucky to have new agents coming into our armamentarium, including Zasocitinib that has now from phase 3 studies, really good efficacy data, as well as safety data that we can welcome to our treatment armamentarium.